What we can offer a GP in our health board area is variety and choice. You can choose to be a generic generalist GP who focuses on your local community, and we really value that generalism. We value that as its specialism in its own right, and recognise that what that brings is the ability to look at the whole person and to care for the whole person within their community and their family. And that's a real strength, and many GPs want that ability to focus on their community and the patients on their list. But as an integrated health board, we also have the opportunities that if you want more of a portfolio career, if you want to link with our universities and undertake research and further training, we can make that possible. If you want more of a specialist role alongside your GP role and you want to work within our hospitals or work within our local communities as a specialist, we can offer you those as well. So we very much believe that we have variation and flexibility around your working hours, around where you would want to live, and in terms of the kind of career and career development that you want to pursue.
I'm really ambitious about what we can do in Hywel Dda. I think we've got a great opportunity to really think differently about how we deliver care to a population whose needs are changing. As a board, we are keen to work with our clinicians, get a very strong clinical voice in how we address some of those challenges. And my ambition is actually that Hywel Dda becomes a place where the delivery of rural healthcare is amongst the best in the country, and that we lead the way in some of the innovative thinking. So I'm looking forward to working with a great set of clinicians who are ambitious, who want to think differently, who want to innovate, so that we can continue to deliver NHS services to our communities.
For me, general practice is a vocation. It's not a job, it's being part of a community, it's providing support and care for your patients. We're still able to provide a cradle to the grave service, and it's quite nice now because I see patients that I've seen since they were babies, now they're going into secondary school, and also I get to look after people as they become older, perhaps develop more chronic diseases, and I've already built up a rapport and a relationship with them.
I wanted to be a GP somewhere where there was a chance for a long-term relationship with my patients and more of a community structure to the area. So I came back to South Wales and ended up back here in Llanelli. It was never my intention, but I'm happy that's how it turned out.
We have a lot of rural communities. As you drive through the area, you see sort of isolated farmhouses on hillsides, and that always intrigues me. How are we going to meet those people's needs? What do we need to do? And the benefit of working in our local communities and working with our local clinicians is they know these people, they understand what it's like to deliver care, and you can do some really exciting things together.
A misconception in some ways that if you're coming down to a rural place, you're going to be in the countryside, but West Wales offers loads of different types of places to work, semi-urban places, very affluent places, some very deprived places as well, and everything in between. If you wanted to find that idyllic rural type of practice, you could find that as well. So you've got more connections than you might realise. You may be distant from this university or that teaching hospital, but I think it breeds this spirit of excellence in what you do.
I just find it fantastic being part of a small practice where the ethics of traditional general practice could be continued, but also being able to give a standard of excellence that I feel is supported locally in other practices and with the health board, giving support to reaching a high standard of medical care, and because of that it's been very professionally satisfying.
I think there's lots of opportunities in general practice, as well as seeing patients. For example, there's opportunities to specialise, perhaps in a certain medical condition, such as dermatology or cardiology, and I think those opportunities will increase in the future.
I personally have a great deal of support from the cancer team and the palliative care team, because that's my area within practice. I've been very lucky to grow within this practice and be supported by my senior GPs, and I hope now that I'm becoming a more senior GP, I'm able to support those that are more junior to me within the practice.
There is support, good support within the area from the local health board and the trusts. If people do want to pursue particular interests, or gypsy interests so-called, yeah, there are opportunities there if that's what people want to do. I think because you work in a rural area, you get more opportunity to do procedures that maybe aren't done in other practices in more rural and more urban settings. So in that respect, you get a little bit more professional satisfaction.
As a Scot coming into Wales, I've felt very welcome, and not speaking Welsh has not been any kind of problem, although there is a lot of Welsh spoken in the area.
Patients may come in and say, do you speak Welsh? And of course, unfortunately I can't, but it's never been an issue. No one has ever been upset. Everybody is able to converse in English, so I wouldn't say it's a barrier.
My husband's a GP as well, and we both work part-time. I work 4 sessions a week and he works 7 sessions a week. So I think we've struck the balance really with a family life, raising 3 kids and work. I think we're very lucky to be able to do that in this part of the world.
Oh, yeah. Yeah. Yeah.
Get up in the morning and I'm headed into work. I think to myself, well, I don't know what's going to happen today, but I know it's going to be interesting. Sometimes it's challenging and difficult. Most of the time it's really enjoyable, and I think that's the unique thing about being a GP.
The benefit of working for an integrated health board is we don't do commissioning. We don't have to commission services from the acute sector. We are one health board. So instead of doing commissioning, we plan, and we plan services for our population. And we do that in clusters. We have groups of GP practices, anything from 5 to 8 GP practices working together as a cluster. And we pull into that cluster other parts of our health board and other essential stakeholders.
I did talk to some friends in a medical school reunion recently, and they were struggling with the problems imposed by commissioning and that sort of process in England, and the fact they're having to set up limited companies to commission services for their patients. And we just don't seem to have that extra level of worry and bureaucracy. So in that respect, we're somewhat slightly more masters of our own destiny and have slightly more control of things, I think, here in Wales.
When you're faced with the prospect of actually becoming a GP partner in a place like this, what you're doing is making commitment to the community that you live in. And that can be quite daunting sometimes, but actually I think it's probably the foundation stone of good healthcare. And people have been doing that in West Wales for generations, and I felt really I want to be a part of this, I want to see it continue, and we felt ready to make that commitment.
If a young doctor wanted to train for general practice, which I think is the best job in the world, then it would seem sensible to come to a beautiful part of the world where there are so many opportunities. There's wonderful countryside, a lovely area to live, to bring up your kids, and an area where there's a strong tradition of social justice and equality and excellence in training. It really is an area where you can come and flourish.